Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Neurodevelopmental disorders encompass a group of conditions that affect the development of the nervous system, leading to impairments in cognitive, social, motor, and language skills. These disorders typically manifest early in childhood and can have lifelong implications for individuals and their families. Let's explore each aspect in detail. History of neurodevelopmental disorders. The history of neurodevelopmental disorders dates back centuries, with observations of atypical development found in ancient texts. However, it wasn't until the late 19th and early 20th centuries that neurodevelopmental disorders began to be formally recognized and studied as distinct conditions. One of the earliest descriptions of neurodevelopmental disorders is attributed to Sir William Osler in the late 19th century, who described children with intellectual disabilities and developmental delays. Since then, research into the causes, symptoms, and treatments of neurodevelopmental disorders has expanded, leading to advancements in diagnosis, intervention, and support services. Symptoms of neurodevelopmental disorders. Neurodevelopmental disorders encompass a range of conditions, each with its own unique constellation of symptoms. Common neurodevelopmental disorders include autism spectrum disorder, ASD, characterized by difficulties in social communication and interaction, restricted interests, repetitive behaviors, and sensory sensitivities. Attention deficit hyperactivity disorder, ADHD, marked by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with functioning in multiple settings. Intellectual disability, ID, characterized by deficits in intellectual functioning, e.g. reasoning, problem-solving, learning, and adaptive behavior, leading to limitations in adaptive functioning. Specific learning disorder, SLD, involves difficulties in acquiring and using academic skills, such as reading, writing, or mathematics, despite adequate intelligence and educational opportunities. Motor disorders, including developmental coordination disorder, DCD, and motor stereotypies, which involve impairments in motor coordination, motor planning, or repetitive and purposeless movements. Symptoms of neurodevelopmental disorders can vary widely in severity and may overlap with symptoms of other conditions, making accurate diagnosis and personalized treatment essential. Treatments for neurodevelopmental disorders. Treatment for neurodevelopmental disorders typically involves a multidisciplinary approach tailored to the individual's specific needs. Common treatments include behavioral interventions, applied behavior analysis, ABA, cognitive behavioral therapy, CBT. Social skills training and parent training programs can help individuals with neurodevelopmental disorders learn adaptive skills, improve communication, and manage challenging behaviors. Educational interventions, individualized education plans, IEPs, accommodations and modifications in school settings can help support academic success and address specific learning challenges associated with neurodevelopmental disorders. Medication. Medications such as stimulants, e.g. methylphenidate, amphetamine, or non-stimulants, e.g. atomoxetine, guanfacine, may be prescribed to manage symptoms of ADHD, while antipsychotic medications or selective serotonin reuptake inhibitors, SSRIs, may be used to address symptoms of conditions like ASD or mood disorders. Occupational therapy, OT, and physical therapy, PT. These therapies can help individuals with motor coordination difficulties or sensory sensitivities improve fine and gross motor skills, enhance coordination, and address sensory processing challenges. Speech and language therapy, speech-language pathologists can work with individuals with neurodevelopmental disorders to improve communication skills, language development, and social interaction abilities. Prevention of neurodevelopmental disorders. While the causes of neurodevelopmental disorders are complex and multifactorial, certain strategies may help reduce the risk or mitigate the impact of these conditions. Prenatal care, accessing adequate prenatal care, including regular medical checkups, prenatal vitamins, and avoiding harmful substances such as alcohol, tobacco, and certain medications can support healthy fetal development and reduce the risk of neurodevelopmental disorders. Early intervention. Identifying and addressing developmental delays or concerns early can facilitate timely intervention and support optimal development in children at risk for neurodevelopmental disorders. Genetic counseling. Genetic counseling and testing may be recommended for individuals with a family history of neurodevelopmental disorders or known genetic risk factors, allowing for informed reproductive decisions and early intervention if needed. Environmental modifications. Creating supportive environments that accommodate individuals with neurodevelopmental disorders, such as providing sensory-friendly spaces, clear communication strategies, and visual supports, can help promote inclusion and reduce stressors. Education and awareness. Increasing public awareness and understanding of neurodevelopmental disorders, reducing stigma, and advocating for inclusive policies and services can help support individuals and families affected by these conditions. By understanding the history, symptoms, treatments, and prevention strategies for neurodevelopmental disorders, individuals, families, educators, and healthcare providers can work together to support optimal development, improve quality of life, and promote inclusion and acceptance for all.